I am just so pleased and excited and thrilled to welcome our chair of Multnomah County, Deborah Kafoury, for some just fascinating and exciting updates on what it means to be low risk. So with that, Chair Kafoury, welcome. So glad to have you. And also big thanks to your team for making this possible today. Just always shout out to the teams, both of the Alliance and over at your office. So welcome and thank you.
Thank you, Andrew. And while my teenagers are being quiet at this very moment, there is a lot of gardening activity going on outside, so I apologize if people can hear that. But thank you so much for inviting us today to join with you. And my name is Deborah Kafoury, and I am your Multnomah County Chair. Wanted to talk with you all this afternoon so we can share some information on reopening. I also want to learn what all of you are experiencing and continuing to engage in a partnership as we move toward recovery. So exciting. And I think I can speak for just about everyone here when I say that COVID-19 has been the marathon that has truly tested every one of our enterprises. And while we still have a ways to go before it's over, I think we can all see the finish line in a way that we never have before. This is a moment to feel hopeful. 67% of county residents 16 and older have received at least one shot. And yesterday, the Oregon Health Authority announced their approval of the equity plan that we submitted last week. And the state authorized moving Multnomah County to lower risk beginning tomorrow. So this is great news. And I want us all to pause and savor this moment. And I also want to thank you, all of you, for helping us get to this point. Lower risk means that we are that much closer to a full reopening. More people can gather in restaurants, in gyms, churches, synagogues, and mosques, and also at work sites, at your work site and at my work site. And as an employer, I've been asking the same questions that you're asking. What do we need to do to serve our clients? How do we do this safely? How do we bring our employees back to work? And what do we do about masks and vaccines? So I wanted to quickly describe how, as an employer, Multnomah County is proceeding. We have about 6,000 employees who work in nearly 150 different buildings, from health clinics to the bridge shop to the libraries. And we are literally in dozens of neighborhoods. And we know that those neighborhoods depend on us coming back, not just for the services that we provide, but because our staff spends money locally, ordering lunch, working out, buying shoes. About half of our staff never went home. The epidemiologists, lab workers, vaccination teams, doctors, and dentists all went into the office to work. And we kept running the jails, our sheriff's office, probation and parole, our emergency operations center, the bridge and road maintenance, animal services, elections, and the district attorney staff all remained on site. So as we look to bringing back the other half of our workforce safely, I asked our department directors to prioritize what our clients need first. And what that means is that our county attorney's office, which provides our internal legal advice, is probably going to continue teleworking. But the folks who answer your questions about their taxes or who issue a marriage license or run a senior program, they will come back into the office sooner. And we're going to continue to be vigilant about watching for symptoms of illness. We're going to continue to educate and encourage everyone to get vaccinated. And we will all be wearing masks. And I'm going to ask Jessica Guernsey, who's our public health director, to talk about how we're dealing with the CDC and the state guidance in just a moment. The COVID-19 crisis has shown us there is so much that we can't control, but it has also shown us how resilient and strong we can be when we pull together for a common purpose, like protecting each other and protecting members of the community that are the most vulnerable, and some of whom might be a part of our respective workforces. I really wanted to come here today also to thank you, the business community. You've used every ounce of pluck and grit to navigate the ever-changing public health guidelines and a very uncertain business climate. And I know that I can count on you, the leaders of our business community, to take on this challenge with me. And with that, I'm going to turn it over to Jessica Guernsey, who's going to share with you a more detailed public health update. Jessica?
Good afternoon, everyone. Can you hear me okay? Good. Hi, everybody. What a spectacular day today. Gorgeous weather outside. It feels like a welcoming, I hope, into a new stage of what we've been through over the last 14 months. It's a pleasure to be with you all today. Thank you, Chair Kafoury. My name is Jessica Guernsey. I use she, her, hers pronouns, and I'm your public health director here in Multnomah County. And I'm going to talk a little bit about the situation we're experiencing currently. And as Chair Kafoury mentioned, the threshold for moving into low risk is a different metric than we were using before in terms of risk metrics and moving around. We now have, oh, I'm so sorry. My phone is not off. We have a metric now that is looking at our single dose at least vaccination rate for the entire county, which we've met, which we're over 65%. So that is really good news. We are seeing lots of progress with the vaccine, and we know it's working. It's working to dampen the spread of COVID-19, which is exactly what we needed to see. So we are moving tomorrow. The state has a wonderful website that outlines the specific criteria and percentages for capacity for different businesses that I think is relatively easy to follow. And we can certainly answer any questions that folks have about that. But just a little bit about what we're continuing to see in Multnomah County. I always say public health is always local. So what is happening in a county is different than what is happening in a state or what is happening in the nation. And I think many of you know that on May 13th, the Centers for Disease Control and Prevention made a recommendation that folks who are fully vaccinated do not need to mask, which again is a federal recommendation that doesn't necessarily take into account local numbers and local jurisdictional decisions. So the CDC, and we talk to them regularly, as you can probably imagine, is definitely not opposed to local recommendations that may differ slightly from what they've put out. And as I think you all know, in Multnomah County, we have put out a public health advisory for folks to continue wearing masks indoors, whether they're vaccinated or not. So again, we know that vaccinations are making a huge difference locally and statewide. But we also know that we have a ways to go. We have vulnerable populations that still need to be vaccinated, and we prioritize people's health. So even though we're seeing a decline in deaths and hospitalizations, we're continuing to see some local spread, although it is on its way down, fortunately. And like I said, we still have about a third of our eligible population that still needs an opportunity to get vaccinated. So again, we are putting out a public health advisory urging people to continue wearing masks in indoor public spaces, whether they're vaccinated or not. We have some materials that we can share with you that support that public health advisory specifically for businesses. So we understand that folks need help with that communication, and we'd like to support you. And then, you know, in terms of how long will this go on? I don't have a crystal ball, and I've been proven wrong before on COVID. As we all know, this is a global pandemic that I hope to never see the likes again. But that being said, I don't know exactly when we will turn the corner on the mask wearing. We certainly won't do it forever, but we want to keep that in place for the immediate future as we work through additional vaccinations and protecting people's health. So we know the business community has been an absolutely essential partner, and I personally want to thank you all for all of the hardship and work and everything that you've done as partners to protect people's health. I know it's been extremely difficult on businesses. I'm very excited to support local businesses more. I live out here in outer Southeast Portland in the Lents area, and I am super excited to be visiting more businesses with my mask on. So we live within walking distance to many different businesses. I'm very excited about that. So of course, you know, we're continuing to promote vaccination in the community and figure out different ways to make sure that people who have not had an opportunity to get vaccinated, the accessibility that they need, and that can vary for communities. Sometimes it has to do with, you know, the burden of getting transportation or childcare, or culturally specific vaccine clinics where people look like you and speak the same language. All of these are things that we are doing now and were highlighted in our equity plan that we turned in last week. So not to sound like a broken record, but again, our big takeaways are if you haven't been vaccinated, get vaccinated. If you have been vaccinated, reach out to your friends and family and see if they need help. So, someone could need a ride, someone could need childcare, or just help sorting through the different information for where to get a vaccine. And then additionally, we are really recommending that folks, whether you're vaccinated or not, that you continue to wear a mask indoors. There really is no practical way for people to distinguish between who's vaccinated and not vaccinated. So right now we are really recommending continued mask use, at least until we hit a 70% benchmark for the state. But again, even then, we're going to be looking at our numbers carefully because, like I said, all public health is local, and we know what's going on in our community best. So I think that's it for my part. I'm here to answer questions. And again, just really want to thank you all for having me here today and your continued incredible work throughout all of this.
Thank you so much, Jessica, and thank you, Chair Kafoury. With that, I'd like to open up with a few questions, and I'll just sort of help with the sorting process here. And I just want to remind everyone to keep those questions coming in the Q&A section so that we can make sure to get those answered. And I'm going to start off a little bit out of order, but it's the thing that for many of us here in Center City, Portland, downtown, have been front of mind since the outbreak happened. And I'm going to start with Jennifer Blakely. She asked a great question, and this is apropos to the guidelines that OHA has issued. And I just want to read for everybody what Jennifer is referencing as a tee up for the question. So when you move into low risk category, we see that it's the office use is defined as limited office work available. And obviously, the county is not responsible for setting these guidelines. It's really important to establish, first and foremost, the county didn't write these guidelines, but can one or both of you help us to understand what does that mean in your eyes? How should we interpret that? And the reason why this matters so much, I know everybody shares this, is that one of the keys to opening downtown is to bring back office workers. They're our daily tourists, right? And the more they're back, the more the retail and hospitality scenes thrive. And so help us to interpret this information. And what is it that you would tell your employees who operate? I'm looking literally at your offices right now across the river. They look great, by the way. What would you tell your office employees, since there's no percentage, there's no capacity issuance? What's the expression you want to let our folks know?
Jessica, do you want to? Well, I
Sure,
can tell you real quick what we're doing from a county position, and I talked a little bit about this in my opening comments. We're really assessing each function, and we're trying to move things along slowly and cautiously, and yet we know that we want to get people back into the office who can be safely there. So that's we're taking an abundance of caution, but we're moving in that direction with a very thoughtful plan of who needs to go first.
Yeah, that's a great question. A couple things that I would say. One, I think this underscores the continued use of masks. So for folks that are returning to the office, again, you don't really have a way to know who's vaccinated and not vaccinated. And I think at least I've heard from businesses, certainly through email and phone calls, that that's an incredible burden for folks to try and sort through that. And I think the masking for now can help with that. So I think that's one really important factor to be considering, because it absolutely has been fundamentally essential in this pandemic. Masking has worked. And we know that because of our numbers in other communicable diseases as well. So like we had no flu season, we had no RSV season. So that means that masking works across the board. So I think that that's an important thing to consider. And then, like Chair Kafoury said, I think it's important to consider sort of how to phase people in. And I know a lot of businesses are getting really creative. I know at the county, we're having this discussion about how do you really just think outside the box in terms of shifts of folks that are coming in, some use of telework, but certainly, as Chair Kafoury said, there's many things that we do that we need to be back downtown. There's some things you can do, and it's doable, but then there's a lot of things that you really do need to do in person. So I think that the masking piece is really important. Staggered work schedules are important. And then OSHA will update their guidelines in terms of different space modifications that will be needed. So those will be really important for businesses to look at. As I know many have, most businesses that I've been going to, well, actually all have already done that. So there's definitely specifications in cubicles that are specific from OSHA that really they provide quite a bit of protection.
I would also add just part of the reason that we're having this conversation with you all today, right, as we're entering into the low risk, is that we know that the state's guidance is not the most clear and understandable. And so part of, we want to be here to collect your thoughts and your concerns as well, so that we can pass them on to the state. We've already done one of these business group meetings and heard some feedback that I sent directly to the governor's office. So we're happy to play that role as well. When there's questions that we don't know the answer to, we will get back to you and let you know, because as we keep saying, we're all in this together, and we're all learning these new rules and regulations at the same time.
That's a great offer. And I think what you're hearing, and I'm seeing a few other questions just around this very concept about offices, and because they're really the most undefined element of the guidelines, right? They just don't have as much specificity as the others. And maybe that is a good thing, but it leaves a lot of these questions. And I see sort of two are really centered around this. So I just want to thank Michelle Gila over at PMAR for asking this one, because I think it's in line with the way that a lot of employers that have office settings are thinking about this. And so she's saying, hey, we have a small office setting and all the staff are vaccinated. Are we still wearing masks? Is that still, and I heard you talk about this a little bit, Jessica, is that still advised when you have an entire office staff that is vaccinated and that isn't a public facing office environment?
Well, I have to be honest with you. I'm loath to use the word safe in any of these contexts. We're in a global pandemic where, I feel like there's been a lot of curveballs. As I said, the public health recommendation that we're making is universal around if you're indoors, whether you're vaccinated or not, we recommend wearing masks right now. So that is sort of the broad brushstroke recommendation. I will say as a footnote, we do know the vaccine is very effective and that it is interrupting transmission amongst people. So in a very, very specific way of answering the question, I think it's very low risk. That being said, we're still standing by our recommendation universally at this point.
That's great thoughts on that. And I would tee up for everyone. We have not sent the invitation out, but on June 30th at 10 a.m. back here live on Zoom, we will be having a how do you reopen your office conversation with some great thought leaders in this space. So we've been premeditating this very conversation. Now that we're here on the cusp of being in the low risk category, I know that employers are just going to be working through this in so many ways. So that's great advice. And I want to follow up now on a question from Randy Miller. Hi, Randy. I hope you're doing well out there. Always love your questions. Actually, this is really important. We saw another round of violence in downtown last night. And the question here is centered around the court system, which, Multnomah County is really the responsibility center here for our court system. And his question is, can we expedite the judicial system, or I suspect the reopening or sort of the court engagement process, so that we can better prosecute some of these behaviors or get the wheels of the criminal justice system moving again? And this is maybe a little separate aside from the question of the low risk category, but really front of mind for so many of the businesses.
Yeah, and I'll take that question. And I don't want to tell you that you're not correct, Andrew Hone, but while Multnomah County is responsible for the courthouse itself, we do not run the court system. So the When courts are open and for how long and for whom is really, it's a state function, and that is up to the Chief Justice. So what I would suggest that people do is to reach out to her, to Martha Walters, and the local head of our courts, Steve Bouchon, Judge Bouchon. He takes his orders from the Chief Justice of the Supreme Court. I do know that we are working very diligently, and our facilities folks have been, to ensure that the courthouse, it is limited operations, as you talked about, but from the facility side, we've worked to ensure that it's ready to go. We've tried to protect it with, with plywood, like many of you have on your businesses downtown. But as soon as we get the go ahead, we are going to be able to open to the public. You may have heard there were some setbacks with some of the construction on the facility, but we're going to be ready to go. And then the DA has assured me that he is ready to go. And in fact, his staff are some of the folks who did not, they did some teleworking, but they also came into the office. They have that pretty new building downtown, so they came into the office a lot. But we are, from Multnomah County's perspective, we are ready to go as soon as the courts reopen fully.
That's great to hear, and thanks for the correction. I appreciate that. And it's good for our members to know it too, because it's always about understanding where the responsibility centers are, and good advice on that. And a little bit just into the weeds on something I think is really a curiosity for a lot of employers. And I see that we have an anonymous inquiry on this one, but it is personal to ask whether or not you have been vaccinated, and whether or not you ask, and then whether or not you ask to see proof of that vaccination. What would you tell employers? Is it okay to go ask someone to show their card to prove that they've been vaccinated, or the honor system? How are you guys working through that, and what advice would you give for employers?
So this is, oh, do you want, Chair Kafoury, did you want to? Okay.
Oh, go
So
for it.
I think this is one of the reasons that helped us make an informed decision about the continued use of masks and face coverings, and what we were hearing from businesses in particular about the struggle to actually implement a system. I saw an email yesterday as a comparison that, folks that have to check driver's licenses for alcohol consumption have a mandatory training of several hours. And, there's a lot of issues around verification of real ID and things like that that are complicated. So it's not a light task. I understand it can be done, and certainly people will choose to do it. But I understand people's trepidation around doing that. And again, it's, again, people could respond in multiple ways. So it's hard to know who's vaccinated and who's not. That's why we felt, along with looking at our local data, that a continued use of masks was a safer way to go. And the governor, expressed that as a backup if businesses chose not to do the verification system, because I do think it's quite cumbersome. It's a lot to ask, especially of, essential workers that have been, handling the duration of this pandemic and really on the front lines day in, day out. So asking folks to handle that is actually quite complicated.
Let's get one of those like really tangible ones. I appreciate this question because I'm sitting here with my vaccine card in my wallet. It's a piece of paper. I've taken a picture of it. I am petrified I'm going to lose this thing. Is there any move to make a little bit more of a durable and maybe verifiable, with some security measures around it, actual vaccine card? Or are we going to be going with the piece of paper in my wallet thing for the duration of this pandemic?
There has not been a real statewide conversation about moving to an electronic verification system. There are some apps out there that I know some states are looking at using. As you probably know, all technology has weaknesses, and this would be a highly vulnerable potential data set with information in it. But certainly there are some national discussions about it. I don't know how seriously the state will consider this for Oregon, especially as we move into just a higher vaccination rate and see the disease drop, because ultimately I'm hoping we will get to a place very soon this summer where we aren't necessarily going to need that.
All right, so here is an interesting question. Gerard Mildner, I just appreciate this. And this is that juxtaposition of the county's services around homelessness, the unsheltered among us, and the COVID-19 outbreak. And the question is an interesting one and intriguing, but is there an estimate or an outreach plan to the unsheltered around vaccinations, and if there's a estimate about how many of the unsheltered are presently, or homeless, I should say, are vaccinated or not? And it's just a curiosity specifically around the ability to use shelter systems, which I know the county has stood up a tremendous number of the temporary systems over the last year during COVID. So why don't you talk our members through that, because it's a high concern and obviously an important question here in the tailing days of COVID-19.
Thank you for that question. We have been and continue to vaccinate our unhoused neighbors, both with our teams, and we're also partnering with local nonprofits who are doing the vaccine as well. And I don't have a number of what the percentage is off the top of my head. I'm happy to find out. I know that it's a continual effort. We also have been doing vaccine clinics in our jails, and unfortunately we know that there's a connection between people who are experiencing homelessness and folks who are in our jails as well. So we've been vaccinating people, adults in custody, since pretty early on in this since we've had the vaccines available. And we do know that once we have a strong idea of how many people we have vaccinated, we will be able to open up our shelters that we, continue to operate, but just at a lower capacity, to the full capacity of those. And I don't have a timeline right now about when that's going to happen. Jessica, do you have anything to add to that?
No, I think you covered it.
Thanks.
All right, well, thank you for that, and great question. And moving now into, and I'll just give the tee up to Blanchet House. Scott, I see you're asking a similar question as Patrick, and this is getting to OSHA. And are there expected timelines for the updated guidelines concerning vaccinated employees in the workplace and ruling for the workplace in general? And if we have any expectations on that, and what your thoughts are.
Yes, I mean, I would expect updated guidelines fairly soon with the shift that we're seeing. And like I said, the metrics have moved from the case positivity and hospitalization to a vaccine threshold, which it's the OHA guidelines and standards that then dictate the OSHA guideline change. So I expect those to come out very soon. I will say though that, OSHA is obviously very, very cautious in their approach to worker safety, as they should be. So I think, it would be reasonable to see probably a step down approach to some of those guidelines, but I think we'll still see some very cautious guidance for workplace safety, as we all care about. So I expect those quite soon.
Great, thank you for that. I see Celeste also asked that question, so thank you for putting that in. And now let's get to restaurants and talk about an industry that has had a really hard go of it this last year. So much of the impacts of the restrictions and closures have really been hardest hit on our hospitality and restaurant scene. So any of you out there who are restaurant operators, we just want to say thank you for making it through, and we're excited about the opportunity to come visit. And here's a question, and I own a restaurant. My staff is 100% vaccinated. Do restaurant workers and staff still have to wear masks?
Well, again, in Multnomah County, the public health advisory that we put out states that we strongly advise that people continue to wear masks indoors for now. Again, we hope that it does not last all that much longer, but in an abundance of caution, given our current situation with disease spread, because the vaccine metric has nothing to do with local disease spread. It just has to do with how many people have been vaccinated, and for that matter, only had their first dose. And as a reminder, 2 of the vaccines require 2 doses weeks apart, and then 2 weeks after your second dose, you have close to full vaccination protection. So there's lots of gaps in there. So again, with a broad brushstroke, we are recommending that people continue to wear masks indoors.
Thank you for that answer. And just now we're going to come back and loop it back into office for a moment. So we're going to, test your ability to flip flop on different settings here. So Barb asked this question and is explaining a little bit about her perspective. So Barb is saying that, her office plans to check vaccine status and to avoid at least the distancing requirements, along with the limited number of staff in the office. If we get to the point where we have vaccinated and non-vaccinated staff in the office, so interesting point in time, and assuming the 6-foot distancing would apply, the question is, assuming this would apply to all, or is there a way we would treat staff differently within an office setting, whether they've been vaccinated or not vaccinated? So here you have a mixed outcome with staff in terms of vaccination. Do you treat different employees differently, depending on their vaccine status?
I wish we had Jenny Madcore on the phone here for a legal perspective. I suspect there's a legal weigh in here on that I'd want to be thoughtful around, and not to sound like a broken record, but potentially from a public health perspective, you would have to, right? Because of everything we just talked about in terms of potential transmission amongst the unvaccinated. But the way that it's currently set up with unvaccinated folks, regardless of our public health advisory around masks, those folks would need to be masked. But, with all the other OSHA requirements that we're waiting for that are probably going to be modified, potentially you would have a situation where you would have to think carefully about that. And again, I truly believe there's probably a legal perspective that should be considered in that.
Always check with an attorney, I suppose, right? So the next question here is an interesting one, and this is really to the county. This comes from Stephen Lean, who runs a small business here in downtown. Stephen, hope you're doing well. So talk us through your the county, just as an employer. What is your vaccination policy for your staff? And what do you plan? What is it today? And are you going to change it into the future?
I think, like all of you, as employers, we're still, digesting the information that we're getting and trying to make plans for the future that that best protect our employees as well as the public that we serve. And we know that at the county, we have some lines of business where we have clients who are extremely vulnerable. So I would say at this moment in time, we have not issued a mandate. I think it's really tricky legally, and it's tricky, practically. How do we've heard stories about, just like how businesses don't want to check vaccine cards, checking people's vaccination status, it can be tricky, whether people are falsifying the information or not. So I think we're still looking at all the avenues that are available to us. Again, with knowing that some lines of business, we do have staff who come in contact with very vulnerable individuals.
And just a footnote to that, I would add, in the state guidance currently for mask use, again, I'm so sorry, I just keep talking about masks. But there are carve-outs, again, aside from Multnomah County's public health advisory, for those working in homeless shelters, healthcare settings, and corrections settings. And part of the reason that, as Chair Kafoury is saying, that we have that is that we know that there have been outbreaks there. And again, just to be absolutely sure, because you can't tell who's vaccinated and who's not, those are carve-outs in the current state guidance.
All right, well, thank you for that. And for so many of us, we will all be a work in progress here for a little bit. So we're with you. This next question from Toby Martin, and this is maybe a little bit more of a broader conversation and not necessarily on the risk categories, but really an appropriate one. So this might be more in the hypothetical realm. So for those of us that are in the central business district offices, is the infrastructure to get people moving in and downtown at pre-pandemic levels? Or should we provide more time to TriMet and others to get back to full speed? So if we see more people downtown starting tomorrow and we see that general buildup, are we ready for that new office and retail and hospitality workforce to be here, or should we be doing more to prepare for that?
I don't think that TriMet is back up to full speed yet. I know I live on a bus line, and I've seen a lot more buses recently than I have during COVID. I know that they're ramping those up. I also have heard that they're not at full capacity, and I think if anyone has driven around town, you will see that the roads seem like the roads are back up to pre-pandemic traffic, and it's my understanding that's because people have not been taking transit as much as they had pre-pandemic. So I think that there's still capacity on the transit system, and I'm sure that TriMet is watching that very carefully. So when the buses start to get full again, they will add additional capacity. But and I'm happy to find out more information on this, specifically what their timeline is for getting back into full speed.
Great question. One of those things we actually have to start thinking about now. In some ways, it's a little harder to reopen and to plan for what that looks like versus those initial days of closure where we all just had to do what was necessary. So this takes a little bit more thinking through and planning than the other direction, which is a good problem to have, I suppose. And let's shift over, because I see two questions that are coming through, and this is particular to health establishment, or more particular gyms, fitness clubs, and things of that nature. So I'm going to ask this question now, and I think this is a great kind of real life, real time decision-making process that a local business owner is going through right now. And I just want to thank them for their question. So many people do not want to restart their gym memberships until they can practice without a mask. And I can get it. You've got a mask on, you're working out, and maybe you're passing out simultaneously because you can't quite breathe as well. But it's still important. Masks matter. Tomorrow, this individual and their businesses are going to be allowing clients that have shown proof of full vaccination to remove their mask while they're on their mat, or obviously doing some sort of a workout, but have to continue wearing it while in the rest of the studio. And the feedback has been really good from clients so far. So is this are they making a good approach to this, or what advice would you have for the gyms out there that are working through this really unique condition?
Yeah, well, first of all, I really want to appreciate the thoughtfulness in which this particular person is thinking about the safety of staff and their clients. And I personally, just as someone who, I'm just gonna be honest, I need to go back to the gym because I've eaten far too many cookies and chips through this whole thing. And I cannot wait to head back to the gym this weekend, I have to tell you. So first of all, kudos for the creative thinking. And that's kind of what I would call harm reduction, which is an approach of, trying to take a practical approach to a difficult situation. I think that probably, is a pretty decent balance of what we're trying to do. Our public health advisory is just that, it's an advisory. It is not a mandate. Again, I can only tell you from our perspective, we are concerned about the continued spread of disease in the community. And we know that there has to be modifications sometimes to situations, especially if, and we certainly have had situations actually with people who are masked, who are vigorously exercising that like lose consciousness or pass out. So, I think that is a reasonable approach. And again, there isn't anything that will completely eliminate the risk. And again, broken record, we're asking people to do their best. If you can, really the best ideal situation is to have everybody masked indoors.
All right. So now on that note, and I'm going to go to two questions very similar in nature. And I think I can almost guess the answer here, but it is just really one of those things that is a hard question for employers. And this comes from Jesse Howe and from Jan. So for service businesses, can we ask for vaccination status of customers before they enter the office space? This is different from retail, different from hospitality, different from gyms. And similarly, there's Young answered just really directly right after that. Do I ask for a vaccination card? But back and centering this on the office environment for those that are doing B2B and service related industry work and in that category of office space that have clients and customers coming in, can they ask their customers for a vaccination card?
My understanding is yes.
Well, it doesn't get any clearer than that. So thank you. It's nice to have clarity. So I appreciate that. And I'm sure that our two members do. So with that, I'm seeing a question, and this gets to the issues of penalty and staff and not being compliant. This is a tricky one. So the question is here, and this is an anonymous attendee is asking this, are there any resources or recourse of penalty if staff do not wear masks? What do you do when you have a staff member walk into a space, retail, whatever, and they're not wearing a mask? What would you advise for recourse?
Is it for staff? Is that the question?
That's right, for an employee. So you've got an employees come in, they're not wearing a mask, they're supposed to be wearing a mask. What recourse is there for that?
I can tell you what we would do at the county, which is we would first talk with that person, have a conversation. We would probably give them a write-up, and then we are available. I mean, as an employer, we can take whatever means necessary to ensure that the staff are compliant. I would recommend people talk with their HR offices if they have one, and with their legal team if they have one as well. But I think you can, if you're an employer and you have an at-will employee, you can do what you need to do to ensure that that employee complies with your rules and regulations like you would in any rule and regulation that you have in your office building.
Thank you for that answer. And I just note, John, big shout out, of course, has just been plugging away here in the chat function, making real-time answers to some of these questions and noting about the office work and what sort of details you can add to that. So everyone should take a look at your chat function because he's really been populating that with good information. So on to the question. I've got one more question here I see, again from Young. This is about a grocery establishment. At this point, moving into the low risk category and groceries and grocery stores, can you ask customers to wear masks at all times?
My understanding is yes.
I think the question around masks is if you are wondering if you have a question on masks, the answer is yes. But that's fair. And you know, the reality is we can't let our guard down. Although this is great news, we are moving into low risk category. There is still a pandemic. Low risk is still risk. So let's just be completely conscientious of the fact that there is still an outbreak of the coronavirus and it is not gone. And we need to be aware and help to maintain this status as we move forward. So with that, Chair and Jessica, I don't see a lot of additional questions at this moment. Maybe you want to just leave us with some thoughts, which I'm sure will include a Go Blazers shout for tomorrow's first home playoff game. But I thought I would just leave it to the two of you because you've been so generous with your time and your thoughts and helping us work through this. What else do you want to share with the business community to take us home here?
Just to keep in touch with us and feel free to reach out with questions and concerns as we move forward. Also on this call, I have my Chief of Staff, Kimberly Melton, and our Sustainability Director / Business Liaison, John Vashetinsky, and we are happy to help facilitate better communication between the state and our local community businesses. And because things are never static in our environment here. As soon as we statewide hit 70% rate, the governor has said that she's going to remove various requirements and restrictions. She hasn't yet said what that will be, but that will be the next hurdle we have to overcome. So I think it's fair for us to take this time right now, learning about what low risk means, making plans for getting folks back into the office, because I think sooner rather than later, we are going to be in a even more or less restrictive environment than we are today.
And I would just say thank you. Thank you to all the businesses again for your amazing work, support, and endurance and perseverance through the last year plus. Just such an important partnership in keeping the community safe. So I'm looking forward. I'm gonna admit I'm not going to the Blazers game. I am gonna frequent businesses out here in Lents and Southeast Portland that I love. So, that's probably going to include the Mercado and a couple other places. So I'm very excited, and thanks for your all's partnership.
We appreciate so much. And I think that is a great way to wrap things up, to shop local, support all the businesses that have been working so hard through all of this. And we are looking forward to a different day here in the county and greater reopenings, and appreciate all that you have done for the public health and making sure that our county and our state have been one of the lowest in terms of outbreaks and all the other troubling things that came with this pandemic. So we see your work, appreciate it, and we're better for it. So thank you. And with that, everyone, have a great day. Go Blazers and be well.